Edwin,
granular.
you want to talk about the national performance goals?
Yeah, so in addition to antibiotic stewardship, there are several changes. And as Howard has alluded to, you've got to really look at the A360 standard set in whole. You can't drill down to one module and think you have everything together, because it is all over the board. There's As I've said before, today, leadership is a trend within NPG. So within the changes to medication management, the first one that was changed was that the pharmacy director will be a registered pharmacist, and that is to be chosen by leadership. And now that is a NPG standard. And then in addition to antibiotic stewardship, the anticoagulant therapy standards have been changed to NPG. So you apply leadership, you apply PI to these clinical patient safety issues or directly. And a few other ones that are specific. And again, when you read between the lines, it is a very common theme within the National Patient Safety Goals. Medication management 020101 EP6 is now NPG 140201, and this is you are to standardize and limit the number of drug concentrations available in a hospital. They're wanting to drive safety, and so that you have fewer variations of concentrations, and also that it is received from the manufacturer in that concentration. They are looking to decrease the potential errors of on-site dilution or concentration. Very focused there. The process to communicate drug shortages and outages to your providers is a standard under national patient performance goals now. And that how you substitutes, I got caught there.
Sorry, I knew the first one was going to be. So
it was me. The national performance goals, and also that you have written substitution protocols, so that you're not having providers just sort of by the whim or back pocket making a substitution. That you've got a evidence-based process for substitution when there are drug shortages or outages. Back to Howard's comment about offsite services or office practices, where you have 24-hour operations but don't have a 24-hour pharmacist, that leadership is a common word is accountable to assigning to a qualified leader the review before the dispensing of medications, and that once the pharmacist is on site, that review is retroactive and 100%. They've also brought over here the automatic dispensing overrides into a leadership standard within national performance goals, so that as an organization, you've got a single systematic way to define what an override is, who can do an override, and how that override is reviewed within the performance improvement process. And then finally, within this broad scope of things, is they brought over the standards about patient medication information, how it's provided to the patients and the families, what language is, what method is used, is all now part of the national performance goals. And that's in looking at patient rights. Are we giving information to a patient, their family, their caregivers in a way that, one, they understand, two, is meaningful, and reduces the chance for medication errors? So, again, a broad variety of components from brought over to NPG. But when we step back and look at the big picture of A360, they're looking at leadership, ownership, performance improvement, reducing preventable harm.